We start with COVID-19 related stories for obvious reasons. 22 new cases of COVID-19 have been reported in Nigeria, bringing the total number of confirmed cases to 276. Of the 22 new cases, 15 are in Lagos, 4 in the Federal Capital Territory, 2 in Bauchi, 1 in Edo State. 44 patients out of the total number have been discharged and 6 deaths recorded. Attorney General of the Federation and Minister of Justice, Abubakar Malami, says his office will continue to fine-tune the comprehensive action plan towards ensuring the decongestion of correctional centers in the country. In a statement by Dr. Umar Jibrilu Gwandu, his special assistant on media, the Attorney General of the Federation and Minister of Justice said the flag-off was part of measures by the federal government to speedily decongest correctional and custodial centers in view of the coronavirus pandemic. This is in line with the provisions of Section 175 of the Constitution of the Federal Republic of Nigeria, 1999, as amended. And in the Federal Capital Territory, Victor Azul reports that 33 inmates have regained their freedom at the Kuje Custodial Center. He joined us earlier to brief on the presidential pardon in Abuja. Here is an excerpt of our conversation with him.
Now, what was considered, for instance, old age was one of the major factors considered in granting the presidential amnesty to inmates. If you are 60 and above, then they want to consider because you don't have really much of your life to spare. And then they consider those who are currently sick. They considered ill health. They considered minor offenses. And awaiting trial inmates, say upwards of 10 years, were also considered.
Okay, so is there any consideration for inmates awaiting trial who have stayed in the correctional centers for a prolonged period?
Absolutely. Just like I said a while earlier, those awaiting trial, say those who have been on that list for, say, 10 years and above, are being considered seriously. And out of all of them, including those awaiting trial, those on minor offenses, those who are suffering ill health, those who are old, aged 60 and above, 39 of them have been granted presidential amnesty by President Muhammadu Buhari. 2 of them granted pardon, 29 released by the FCT administration. And so in all today, we expect that about 70 inmates will be released.
Telephone conversation. Now, Professor Etamini Alemika joins me in the studio to speak on this current happening. He was a former chairman, Prison Decongestion Committee. You're welcome to Nationwide, sir.
Thank you.
Okay. It does seem like COVID-19 is helping us fast-track the decongestion of Nigerian custodial centers. Is this like a good omen?
We must recognize that 2,200 inmates is just a small fraction of the total population of the prison. An average prison population today is about 70,000. So 2,200 is just a fraction. But I think the principle is welcome and may not just be considered in the context of COVID. The Administration of Criminal Justice Administration contains quite a lot of provision that envisage that we'll have fewer and fewer people sent to prison for different offenses. And of course, the latest law, the Nigeria Correctional Services also follow the Administration of Criminal Justice Act to ensure that we do not imprison people who need not be in prison. So in the context of the present one, of course, most of our prisons in the urban areas are very congested, and therefore 2,200 is just a small proportion. But we must understand the complexity of the proposal. I've read the proposal. The federal government is releasing 70 from Abuja, and then was, according to the news, the rest will be undertaken by the state. But across the state, the federal government also have people who are convicted on account of violation of federal laws. So I think the federal government can still do far more. If they can do 70 in Abuja, I'm sure they can do a lot in Lagos, a lot in Port Harcourt, a lot in Kano, Kaduna, more than that. But I think the criteria used is very important. There is actually a standing committee on prison congestion, and I think those criteria used must have been those that are being used by the standing committee of prison congestion. Okay. It's welcome, but I'm not sure it's going to make a major dent on the population. Okay,
maybe little steps you may say, but I'm just thinking, going forward, how do we evolve a structure that will ensure speedy dispensation of justice to curb overcrowding in these centers?
Yeah, I think that is the challenge of our approach to prison discongestion. The correctional centers are the last stage of the criminal justice administration. So you do not start decongestion at the end. You have to start from the entry point. As long as you have a wide entry point in the kinds of people arrested by the police, by other law enforcement agencies, as the net is wide, you will continue to have congestion at the prison level or at the correctional center level. So what we need to do is to look at some of our laws, decriminalize a number of them that will not really constitute threat to anyone or to majority of people. Also to provide the alternative way of dealing with minor offenders, which of course I think we now have laws that allow us to do that in Administration of Criminal Justice Administration and in the Correctional Service Law.
Okay, talking about allowing or pardoning ex-convicts to go, I'm just wondering, we understand there is reforms going on right now on rehabilitation. What would you proffer as an action plan towards sustaining these reforms?
Yeah, I'm not sure what took place is essentially pardon. There's a difference between pardon and the kind of release we are talking about.
I'm talking about, I know there is a process going on to pardon over time, not this particular one.
Okay.
Yes.
Yeah, there is a process which, again, I think is the same criteria that have been used in this short term to ensure that people who are terminally ill are not kept unnecessarily because you do not benefit anything from doing that. Then also to ensure that people who have minor offenses are not dealt with in a very severe manner. If you look at the cost of remanding people, it has to be for serious offenses. It's not sensible for any government or any state to continue to remand people who have minor offenses. Somebody stole 10,000 naira. You are going to use 30,000 naira per month to feed him, not to talk of the cost of the infrastructure, the cost of payment of personnel in the place. So we need how to look at the cost effectiveness of the process we are using.
Okay, what will be your position on the pardon granted Ambrose Lee and Anthony Enahoro?
Yes, those are, depending on the way you look at it, some will say they were convicted in the first instance for political offenses, which is always a very shaky ground as to whether they ought to have been, pardoned, said to have committed a crime. But I think for both of them, they deserve it, given their contribution to national unity, national development, even after their conviction. And I think they prove that they deserve it.
That will be your final word, sir?
Yes, okay. I think they deserve it.
Thank you very much, Professor Etanibi Al-Lemika.
Yes, thanks so much. Yeah, thanks for having me.
Okay. Moving on, the need for collaboration among states and partnership between state governments and the people in the area of sensitization and social distancing has been highlighted as necessary steps in curbing the spread of the coronavirus in the country. This was cited when guests on NTA's program, Good Morning Nigeria, were analyzing situation reports from the state. Alika Okpanachi completes the report.
After the initial scare of being positive to coronavirus, the Oyo State Governor has been given a clean bill of health. For social observers and key players in the state, it was a wake-up call to put adequate measures to further fight the spread of the virus in the state, which has a total number of about 11 confirmed cases.
We have established right now a full major center, that is Olodo Infectious Disease Center, which is the state-of-the-art center to contain not only the COVID-19 case, but any form of epidemics.
In the case of Kwara, there has been 2 recently confirmed cases, and efforts are being intensified to track down those who have had contact with the affected persons.
Every step that we take has significant repercussions and social implications. So if you do shut down, how long can you sustain it? How long can you feed people? What's your capacity to be able to provide amenities for people?
In Abia State, the executive governor says all hands have been on deck to maintain a coronavirus-free state, with sensitization ongoing and total compliance on social distancing.
We have an office that is taking care of people with physical disability and the motherless babies' homes. So we have a very robust way of pushing down our palliative items.
Situation reports from Kebbi State is similar to Abia, with the governor, Abaka Gbagudu, maintaining his stance on proactive measures to ensure the disease doesn't find its way into the state.
It has been working, and I must commend the good people of Kebbi State.
We can't ignore the effectiveness of some of these alternative medicines. Many of them are capable of boosting your immunity. So they are not specific against the virus.
The guests advised that tackling the issue will entail, among other things, state governments engaging the services of traditional and religious leaders in adequate sensitization. In Abuja, Alika Okwanachi, Arua, NTA News.
And still on situation reports from the states on COVID-19, some of our correspondents now join us live to give perspective to events in their respective states. We have Joy Ken Abakboya in Lagos, Abdul Hafiz Alaya in Offa, Kwara State. Ifoma Ihoje joins us from Uyo, Akwa Ibom, and in Kaduna, Mejama Adamu. Thank you guys for joining Nationwide. Joy, Lagos is the epicenter of COVID-19 in Nigeria. Also, with the highest number of discharge, is the recovery rate inspiring hope amongst the people?
Thank you, Hawa. Yes, it is. I would say it is. 32 people were discharged earlier, and then just a few minutes ago, the Lagos State Governor announced that 7 new patients have been discharged. 1 female, 6 males, and 3 of these persons are foreign nationals. This announcement by the governor is bringing more news to the people here in Lagos. There's no tension at all, even though we have in Lagos the largest number of COVID-19 patients. We also have the largest discharged persons, so it is not a problem here at all. However, experts have said, the opinion of experts right now is that community transmission has begun, and that is where the worry is. The lockdown, which is ongoing now, is one of the measures put in place by government to limit person-to-person transmission. This way, we can at least break the chain of transmission here in Lagos.
Okay, in the course of covering this epidemic, I'm just wondering if you've had an opportunity to interact with any of the discharged patients?
I haven't had the opportunity to talk with any of them, but I spoke with one. She didn't totally talk to me. She just said she can't talk for now because doctors have told her to stop talking to the press because of her mental health.
Okay.
At this moment, I haven't had any interaction.
Okay, thank you, Joy. That will be all for now. Let me go to Abdul Hafiz in Offa. We understand Offa is the only lockdown location in Kwara State. How is this coming up?
All right. Offa, as the hometown of one Muhyiddin Obanimumu, a suspected COVID-19 patient who died at University of Ilorin Teaching Hospital. So, and the 2 major confirmed cases from Kwara State are also traced to Offa. As a result of this, a 14 days total lockdown was declared by the state government, and presently, people of Offa are complying to the total lockdown 100%. Security agencies are stationed at all entry and exit points to the community to monitor compliance in Offa.
Okay, so the town is in complete lockdown. No people milling around?
No movement. Even the so-called the essential workers who are exempted, like motor parks, the food vendors, pharmacy shops, they are all complying with the total lockdown. They are not out. Everywhere is deserted.
Okay. Okay, I'll put you on pause for now and go to Ifeoma in Akwa Ibom. Akwa Ibom recorded 5 cases all at once. Considering the challenges associated with contact tracing, how has that been, Ifeoma?
The 5 patients are actually doing well. They are responding to care and very hopeful. And then the contact tracing is on. Identified contacts have been reached, visited, and provided with self-isolation kits, including personal thermometers. However, investigations reveal that about 27% of them, of the traceable contacts now, reside outside the state, and surveillance alerts have been sent to them. The team is working hard.
That looks like a Herculean task, tracing contacts.
Yes, within and outside the state.
Okay, okay.
Yeah.
I would go to Kaduna now to join Major Ma. Major Ma, Kaduna has a stringent rule that if you pass through its boundary, you must be ready to be quarantined for 14 days. How is that playing out?
Well, how the Standing Committee on COVID-19 in Kaduna is taking a more definitive and more decisive measures, taking into account that the initial partial lockdown and the subsequent 24-hour curfew imposed on the state have been grossly occasioned by non-compliance by large portion of the citizenry. The Standing Committee, headed by the Deputy Governor, Dr. Hadiza Balarabe, herself a medical expert, has now decided to lock on the state with very stiff measures. Travelers into the state have 2 options now, if their destination is Kaduna State. Whether they subject themselves to 2 weeks isolation or they turn back and go back to where they come from. Passengers or interstate transit with valid permits are allowed passage through the western bypass outside the state. This is the situation. Around town, the enforcement is more decisive than ever before. When we went around town today, even the military have now been drafted to assist in the enforcement of the lockdown in Kaduna State. This is informed by the fact that the Kaduna State believes prevention is the only way out. And information at the disposal of this Standing Committee has it that unless more decisive or terrible measures are taken, the epidemic will take the state like wildfire. This is what the committee said it is not going to allow. As such, they will spare no expense in safeguarding the sanctity of the life of the entire people of Kaduna State. So they have just reviewed this lockdown by yesterday, and the enforcement today has been more than ever before. This is the situation in Kaduna, while we have 5 confirmed cases, including the state governor, His Excellency Nasir Ahmed El-Rufai, who now getting the information that he is responding positively to medication and is expecting to be tested negative anytime soon. This is the situation in Kaduna at the moment.
Okay, Major Ma, before I release you, in 10 seconds, what would you say it's your final word in terms of how the people are cooperating with the authorities to ensure that we achieve the goal?
What I said earlier, initially, the major section of government is getting a lot of non-compliance by the public. But because of its decisiveness, the government has now resorted to. There is substantial compliance by the citizens, especially in the state capital. The issue of people moving around like business as usual is what happened today. Since this review has come into effect by yesterday, people are now accepting to stay at their homes. Otherwise, they are going to meet with a lot of trouble if they decide to enter into town. So we can confirm to you that there are substantial compliance with the lockdown order right now in Kaduna State.
Thank you very much, Major Ma. We truly appreciate your contribution. Let me now go over to Ifeoma in Akwa Ibom. Ifeoma, in 10 seconds, what will be your final word in achieving the desired goal?
Sorry, I didn't get that.
In 10 seconds, what would be your final word on the situation in Akwa Ibom in ensuring that the goal is achieved?
Well, I think the people would have to adhere to the sit-at-home directive because experts have said that is the surest way to contain this pandemic. If they can sit at home and allow the team to trace the contact,
and do the needful, I'm sure that in a very short while, everywhere and everyone will be okay.
Sure. Everywhere will be safe. And Abdul Hafiz, I would now take you on my final question, and that is, everywhere is on lockdown. But what would you say is the way the people, what is their reaction? Are they happy that this has to take place for them to be safe?
Yes, they are happy in the sense that even before the announcement of the total lockdown, the people are already living in palpable fear of being infected by the virus because of the 2 major cases that have been traced to this very community. So, and the OFA Descendant Union are also on top of the situation as they are trying to help the main technical committee to trace those who have had contact with the confirmed cases. So they are happy and they are ready to comply with the total lockdown.
Thank you very much, Abdul Hafiz in Kwara. Joy, I guess you had so much to talk about, so I would just say thank you very much for contributing to Nationwide today, while I joined Dotun, still in Lagos, for more on Nationwide. Hello, Dotun.
Thank you, Awa, for joining us in Lagos. Now, following the outbreak of coronavirus in Nigeria, another set of 109 nationals from European Union countries are set to be airlifted from the Murtala Mohammed International Airport in Lagos. Ken Igbeluge reports that the returnees are to be taken back to their countries by Danish airline.
At the departure hall of the Murtala Mohammed International Airport, activity was at an all-time low. 4 scheduled flights were cancelled. These passengers were among the lucky ones who were able to secure seats on a chartered Danish airline. The aircraft is expected to airlift them to Oslo, Norway.
Flight arranged by the Norwegian Ministry of Foreign Affairs, and where we work closely with the Nordic countries. So a major number of Nordic citizens, but also a few from various European countries that are going along.
The 109 passengers are nationals from Denmark, Belgium, Netherlands, and the United Kingdom.
Normally I was supposed to leave the 30th of March, so my flight was not going. It was KLM Airlines. So now we want to go home to meet my family.
Long journey, we go to Oslo first with Danish Airways, then we go to Amsterdam, and then from Amsterdam to the UK. So it will be Saturday afternoon before I get home.
I can't even wait to go back to work, and make some money and be able to send it back home as well.
Meanwhile, Air France is expected to evacuate French nationals later this week. In Lagos, Ken Igbeluge, NTA News.
It's 3 days to Easter Sunday, and the economic nerve center of Lagos, Balogun Market, one of the largest and busiest markets in the country, is slipping owing to the lockdown. Ruth Ariosama went round Balogun Market and brought back this report.
The erstwhile busy Balogun Market has become a shadow of itself, as roads that were difficult to navigate due to heavy vehicular and human traffic are now deserted. Driving through was without obstacles, as there were no cars honking or pedestrians getting in the way. One thing that stood out, however, are these empty shops, which stand as proof the fight against this deadly virus is intense. A few of the traders hanging around lamented their plight, as the lockdown has dealt a huge blow to their means of livelihood.
A client called me that he needs something, and I have to run down here to make sure that I get that money, because without that money, my brother, we are red. You don't red. Without that money, I cannot feed my family.
They, however, understand that business losses are a small price to pay to stay alive and protect the lives of others. In Lagos, Ruth Ariel-Samuel, NTA News.
And that's it from here. Nationwide continues in Abuja.
Very well, Dotun. Earlier on, the Senior Special Assistant to the President on Public Affairs, Ajuri Ngelale, was with my colleague Joseph Johnson, and he spoke extensively on Nigeria's integrated national response plan on COVID-19. Listen.
I think the initial opposition we had heard was based on a misunderstanding of what it was that the medical professionals from China were here to do. The presence of these medical professionals from China. We've made it very clear that these individuals are, virologists, individuals who understand the complexities involved with an outbreak of a virus, and clearly with their experience in Wuhan, they have shown that amongst all the countries in the global community, that they have shown that they have been able to kind of stem the tide. So just to expertise with our professionals, so that our professionals are just that much more equipped to deal with some of the issues around the outbreak. But in terms of, the idea that there's some sort of threat in terms of impinging on the ability of our practitioners to practice medicine, that simply just does not exist.
Indeed, because that's been good.
We take some messages now. When we return, more reports.
For now, the best and most efficient way to avoid getting infected is through regular hygienic and sanitary practices, as well as social distancing. As individuals, we remain the greatest weapon to fight this pandemic. By washing our hands regularly with clean water and soap, disinfecting frequently used surfaces and areas, coughing into a tissue or elbow, and strictly adhering to infection prevention control measures in health facilities, we can contain this virus.
The coronavirus, also known as COVID-19, is spreading at an alarming rate all over the globe, including Nigeria. With the number of infected persons in Nigeria increasing daily, prevention is better than cure. Coronavirus has no cure. The virus spreads from one person who affects two persons, and by the time the affected person is isolated, the two persons have affected four, and it keeps spreading. You must take preventive measures to save yourself and that of the people around you. Always wash your hands with soap and water. Put distance between yourself and others. Whenever you cough or sneeze, cover your mouth. Clean and disinfect surfaces. Stay at home if you're sick and contact the proper authorities. Together, we can cut down the spread of the coronavirus. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest TV network.
And it is irregularities in his breathing. The first thing they said was he has a Down syndrome, but the Down syndrome thing is not even the problem now. It is the heartbeat that definitely has a hole in his heart. That was where oh my God, that day was just a different thing.
Coronavirus is real. Steps to avoid this pandemic. Wash your hands regularly or sanitize your hands. Keep social and physical distancing. Avoid crowded places. Stay at home unless absolutely necessary. Don't touch your eyes, nose, or mouth if your hands are not clean. Avoid the spread of coronavirus. Coronavirus is real.
There is a lot of fake news and report circulating, especially on social media, on the coronavirus. Do not believe or partake in the spread of these fake reports. If it is not on the official website or news from the Nigerian Center for Disease Control, NCDC, disregard such report. Only together can we beat this virus. Only together can we overcome this pandemic. Follow the instructions and guidelines provided to combat this virus. Most importantly, stay at home, self-isolate, regardless of your status. The virus doesn't move unless we move. Let us work together to better Nigeria. Together, we can do this. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
Thanks for rejoining us. Moving on, with no known cure yet for the coronavirus, health authorities advocate improved personal hygiene and community sanitation, especially now that the infections in Nigeria are at community spread level. What is the current assessment of environmental health services in Nigeria? Dr. Nuhu Solomon Ayegun is the Deputy National President, Environmental Health Officers Association of Nigeria and Provost, College of Health Sciences and Technology, IDA, Kogi State. Good afternoon to you, Doctor. Give us a sense of where we are currently with environmental health services in Nigeria, especially now that your services are part of the National Response Plan on COVID-19. Can you hear me? Okay, I guess we will seem to be having issues with the connection, but we will join Kemi in our Ibadan Network Center with more reports on intervention to contain the COVID-19 in Nigeria. Hello, Kemi.
Hello, Hawa, and welcome to Ibadan. Ogun State government has stepped up efforts to curtail the spread of coronavirus in the state with the commencement of a week-long disinfection of public places across the state. Correspondent Joel Popola reports that the exercise will be done consistently until COVID-19 is totally eradicated.
The week-long disinfection of public places is a statewide proactive measure to nip the spread of COVID-19 in the bud. Olabisi Onabanjo Market in Ijebu-Ode was given priority in view of its strategic location and hordes of traders carrying out business transactions in the market. Ogun State Commissioner for Environment, Honorable Abiodun Abudu Balogun, who led the team from his ministry to the market, said the exercise will go a long way in reducing the risk of contracting coronavirus.
This particular exercise is not that general fumigation. It is this infestation targeted specifically at coronavirus.
He urged residents of the state to cooperate with the state government to ensure the success of measures put in place to tackle the virus. Apart from markets, schools, motor parks and other strategic public places will be fumigated before the expiration of the lockdown. In Ijebu-Ode, Joel Bukbola, NTA News.
Money is a medium of exchange either in the form of coins or banknotes. Grace Bamidele in this package examines the possibility of a spread of COVID-19 through handling of cash.
Thank you very much. Cash exchange is necessary for transactions. According to public health experts, contaminated droplets of the coronavirus can live for hours on surfaces, including the Naira notes.
Cannot catch coronavirus from money because we need money and we have to spend money.
All those currencies circulating, they carry all the diseases, which may include coronavirus.
What then is the way out?
But if someone is infected and coughs into his hands and holds cash and gives it to the next person, there's the probability of being transmitted through cash. So the best thing to do is to ensure that when you handle money, you don't know who has touched it. Money on its own is dirty. Then you need to wash your hands all the time.
With considerations on full implementation of the cashless policy, utilization of automated teller machine ATM might not be an advantage.
Even touching the buttons of the ATM, touching railings around, all those two, we don't know how long the virus can stay on the surface.
No one knows how far a particular bill has traveled in the event of day-to-day transactions, hence the need for strict adherence to expert advice on proper hand washing after handling cash. In Ibadan, Grace Bamdele, NTA News.
And that's it from Ibadan. It's back to Howell in Abuja for more on Nationwide.
Very well, Kemi. I understand Dr. Nuhu Solomon Ayegun is now ready for us. Doctor, give us a sense of where we are currently with environmental health services in Nigeria, especially now that your services are part of the National Response Plan on COVID-19.
Thank you very much. I discovered that the occurrence of coronavirus infection has driven this country back to the right track. And as at the moment, our officers from the different states of the Federation have been mobilized for intensive sensitization. And again, they are carrying out decontamination and infection of city metropolis in our different states of the Federation. And this also is the right thing that we need at this very time, since we know that this disease is actually transmitted through the environment. And we are happy that government of the Federation is cooperating, and they are doing the right thing presently. But I want to emphasize that we should pay particular attention to social distancing, observance of personal hygiene, this respiratory hygiene by covering to the elbow and covering our mouth when we sneeze or cough.
Of course, that's very important. But how can we sustain action on environmental health services in Nigeria post-COVID-19, considering the fact that I understand you guys are very few in number across the nation?
Yes. Now, if the environmental services has to be sustained, then government must put in place the following one. They need to employ adequate environmental health officers in the different tiers of government, right from the Federal Ministry of Health, Federal Ministry of Environment, through all the states of the Federation and the local government areas. We must have adequate number of environmental health officers on ground, according to the World Health Organization specification of one environmental health officer to 8,000 population. And again, necessary logistics must be put in place for us to reinvigorate and to revive the usual house-to-house inspection and the procurement of necessary gadgets and equipment for environmental monitoring must be put in place by the government of this our nation.
Thank you very much, Dr. Nuhu Solomon Ayegun, Deputy National President, Environmental Health Officers Association of Nigeria. And our next stop will be Jos, and Zenret is our guide.
Thank you, Hawa. Good afternoon and welcome to Jos. As Plateau goes into a total lockdown from midnight Thursday, 9th April 2020, the state government has set up 10 mobile courts to try violators of the order. The mobile court is to ensure enforcement and compliance to the directive. In light of this, Sadat Mohammed Kafa is in Jos Township for last-minute preparations of residents few hours to the lockdown. Sadatu, how is the mood in town?
Right now, we are at the busy Bukuru Kugia market in Bukuru, and as you can see, the market is busy with customers buying in bulk for self-sufficiency during the lockdown period. With me, I'm with Susan. How can you explain the lockdown tomorrow?
The lockdown is, as for me, is very, very good because of the situation we are passing through in this country. So I'm here to do my last shopping, and everybody is in the market too, even though no money, so we are managing it.
It's a sacrifice that we have to make, because regardless of what happened, it's important to stay alive, except for the fact that I have this opinion that the state government would have made provision for palliative because people are suffering.
This one will hurt us, but what the government do is good for us.
Today I get customer, but tomorrow is that we're not going to see anybody for this market. Even the quickly that we are buying at the rate of 400 before, now is 700. Rice, local rice now is 500, is 1,000 naira. So things are very costly. We just pray that let the government help us so that they will reduce the price of the things so that we can be able to buy and feed our children. Other places is affected with beehive of activities are motor parks, while travelers are traveling to avoid being caught in the lockdown.
It's very costly. We are talking to the driver right now. He's saying we should give him some money above what we have been paying before.
The transport fare is too costly, more than the one where we are used to pay.
There is no case of COVID-19 in the state. The fumigation exercise is a proactive measure by the state government to contain the spread of the virus. And he's back to the studio.
Thank you, Saadatu. Meanwhile, security operatives in Plateau State have expressed readiness to ensure compliance to the total lockdown directive by state government for the fumigation exercise across the state. Commissioner of Police Plateau State Command Isaac Akimoide stated this during a combined show of force with security agencies. Kim Gotts reports.
The show of force indicates the preparedness of security personnel to ensure full implementation of government directive of the total lockdown of the state, which will commence from midnight Thursday 9th through Wednesday 15th April 2020. These forms part of measures to contain the spread of COVID-19 pandemic in Plateau. Addressing officers and men of the combined security team, Commissioner of Police, Plateau State Command Isaac Akimoide charged them to be civil in discharging their duties during the lockdown period.
The Plateau people should be patient with law enforcement agents. The Plateau people should try as much as possible to remain at home because this virus does not have leg to walk with. It's human beings that carry it from one place to the other. The law enforcement agents are also ready to ensure that this objective is achieved.
The show of force toured major streets and markets within Jos Bukuru metropolis. In Jos, Kim Gotts, NTA News.
That's it from Jos. It's back to Hawaii and Abuja for more news on Nationwide.
Thanks, Zenret in Jos. The Special Advisor to the President on Social Investments, Mariam Uwais, says the attack on the operation of the Social Investment Program is not justified in view of the successes recorded on the program. In a response to the selection of beneficiaries, Mariam Uwais said her role and singular focus has simply been to comply with the terms of agreement and the MOU entered into by the federal government of Nigeria, as well as established an objective of an efficient and transparent process for uplifting the poor out of poverty through structures and mechanisms that are credible and sustainable. Mariam Uwais described as untrue and regrettable claims that information about the NSEPs was not accessible to the National Assembly, stressing that all invitations to public hearings and meetings were honored, and documents relating to the structure, activities and progress of the NSEPs were routinely shared with the National Assembly over the period that the program was under the office of the Vice President. She described also as misleading the allegations that the program gapped over 2 trillion naira since 2016 when the fund was created. Meanwhile, the conditional cash transfer of the federal government today has gone beyond just providing succor to the poor and vulnerable persons in the country. For Asuko Andem, one of the beneficiaries in Odukpani local government area of Cross River State, the money has literally resuscitated his ailing mother at this time of lockdown. Umar Basi Edit has more.
Do something is good because like my mom see, she's not well. So for now, government help my mom see to wake up now. My mom see feel normal.
Asukwo Andem is one of the 11,995 beneficiaries of the conditional cash transfer in Cross River State. Others too have this to say.
Federal government, thank you. And God bless in Jesus' name.
This money will help me to do any other thing, my farming, my business, my children in school.
In Cross River State, 235,900,000 naira is to be paid to beneficiaries across the 18 local government areas of the state.
And there's what is called the top-up. Top-up is paid as extra to
the vulnerable groups. So for this particular set of people, as against 20,000 naira that is paid to the other vulnerable groups and poor families, these people are receiving 40,000 naira as we speak.
The payment made to the poor and vulnerable households would also cushion the effect of the COVID-19 lockdown. In Odukwan local government area of Cross River State, Umo Basidate, NTA News.
About 5,000 indigent residents of Ekiti State have benefited from the conditional cash transfer of the federal government to alleviate their challenges during the lockdown to curtail the spread of the COVID-19. Yemi Dalemo reports that the Ewi of Ado Ekiti commended the federal government's initiative to provide succor for the less privileged.
The conditional cash transfer program is aimed at reducing poverty and giving the beneficiaries sense of belonging to make them pull through the hardship occasioned by the government lockdown to curtail the spread of coronavirus in the state. The beneficiaries in Ekiti State, totaling about 5,000, said the stay-at-home order affected them in many ways, but the federal government support came at a time it is highly needed, expressing appreciation to the government for putting smiles on their faces.
At least I didn't have anything before, but I thank God that I can be able to establish business. And I'm sending provision now.
Presenting the cash of 20,000 naira each to beneficiaries comprising of January to April payments, Ekiti State Governor Dr. Kaude Fayemi represented said the assistance is to cushion the effect of the lockdown on the less privileged and uplift their household during this period.
It's a government that puts the people in the center of all their plans.
Ewi of Ado Ekiti, Oba Rufus Adejugbe, commended the federal and the Ekiti State government.
I thank the government for taking the initiative, but to continue to talk to our subjects and the way to do among them. This is time for them to come and assist the less privileged.
The program is one of the government poverty alleviation initiatives to lead many Nigerians out of poverty, as promised by President Muhammadu Buhari. In Ado Ekiti, Yemi Dalemo, NTA News.
And in Uyo, the Akwa Ibom state capital, Nigerians are commending President Muhammadu Buhari and the federal government for the approval of 500 billion naira to improve the nation's economy crippled by the coronavirus pandemic. Udwak Etim completes the report.
In order to address the global health threat, COVID-19, and the nation's economic challenges, President Muhammadu Buhari had recently given approval for a 500 billion naira stimulus package as part of an integrated policy framework to ensure that Nigeria's healthcare system and economy are sufficiently supported. The decision by the federal government prompted reactions from Nigerians who described the move as a step in the right direction.
I think the president has a very important vision concerning the country. I am so optimistic that the money that the president has released would cushion a lot of things, especially when it comes to the health sector.
I think it was a decision in the right direction. That I also believe that that money will be used for the purpose in which it is meant for.
If this money is being released, they should know that this money is being used for the sake of the people, the sake of Nigeria. So it should be used properly and sincerely.
The proposed intervention fund, according to the federal government, would be utilized to upgrade and support states in improving health facilities, as well as finance the creation of a special public works program, among others. In Uyo, Udwak Etam, NTA News.
And it's time to join Ogochukuka in our Benin Network Center. Hello, it's your turn.
Good evening. Edo State is on partial lockdown, and government has directed that all residents must be on protective face masks in public, among other measures. And to drive this point home, government has begun full-scale enforcement, and some of the traders not exempted are already being apprehended for not complying to this and the stay-at-home directive. Elizabeth Omoko has a situation report.
Like other states, the stay-at-home order exempted a class of workers and traders.
But these set of traders at the popular Lagos market at the King Square decided to disobey.
I just come from inside the house. I don't know what is happening. You just come on.
This market now.
This house is not market. It's inside the house.
Don't talk anything, madam. Now watermelon at the sale.
Governor Basiki, in a state broadcast this Wednesday, rolled out additional measures to contain the spread of the COVID-19 pandemic.
It is now compulsory that every person in Edo State must wear face masks while in public. The Edo State Association of Tailors and Fashion Designers are mass producing high-quality, reusable face masks at affordable prices.
Monitoring the level of compliance, it was observed that it is business as usual as the level of social distancing and wearing of face masks are still low.
The hike in the prices makes it very, very hard for people to afford it.
Me not having face masks is because government failed to give us, and it's their responsibility for government to give us face masks.
Although traders have all moved to designated school premises to display their food items, they still complain of not too conducive space. In Benin, Elizabeth Omako, NTA News.
Meanwhile, traditional rulers in Ondo State have raised concerns over the rapid spread of coronavirus if the level of advocacy fails to get to the downtrodden and the vulnerable. To this end, the traditional institution in the state has joined hands with government in sensitizing the subjects on the need to be cautious. Olajide Bello reports.
One of the ancient towns in Ondo State, a motorized town crier provided by the monarch, the Olawo of Owo, His Imperial Majesty Ajibade Gbadegesin Ogunye. These are critical times, and the Oba realizes this and has keyed into government's clarion call to sensitize the people to protect themselves against the ravaging coronavirus.
Our Kabiyesi Olawo Gbadegesin Ogunye. I say, even at the war, even at the shop, before the shop, I wash the hand.
All other activities, be it chieftaincy, be it marriage that is related to the kingdom, we have suspended everything.
But when things like this are happening in the society, you don't wait to become an index case before you do the needful.
The town is devoid of much traffic on the roads. From our local government's area in Ondo State, Olajide Bello, NTA News.
The news continues in Abuja. Good afternoon.
And in Abuja, medical protective items delivered to Nigeria by the China Civil Engineering Construction Corporation have been decontaminated in line with international health regulations. Onengie Fineface reports that the aircraft and crew members were also disinfected to ensure that the virus is not carried into the country from China.
Items decontaminated include test kits, ventilators, disinfection machine, disposable medical masks, rubber gloves, protective gowns, goggles, infrared thermometers, and face shields. Performed by environmental health officers, the exercise is aimed at protecting Nigeria from possible COVID-19 infection through the items coming from China, which had a high burden of the virus weeks ago.
For now, we can categorically say that this flight has been given the clean bill of health to be able to disembark from Abuja to Lagos. The next stage of the decontamination is we are going to decontaminate the risk area using heavy equipment that we have deployed for this assignment.
On arrival in Lagos, further decontamination will be carried out before the items are cleared for distribution and use. Meanwhile, plans are underway by the Ministry of Environment to decontaminate all the 4 international airports which are gateways into Nigeria. In Abuja, Onengie Fineface, NTA News.
The Inspector General of Police, Mohammed Adamu, has directed commissioners of police in states where the social restriction orders are in place to sustain the restriction directive. In a statement by the first Public Relations Officer DCP Frank Mba, the IGP felicitates with the Christian community at Easter and calls on religious leaders in Lagos, Ogun and the Federal Capital Territory, as well as other states affected by restriction orders, to continue to cooperate with relevant government agencies and use their leadership positions to encourage worshippers to observe prayers and worship programs in the confines of their homes. Sports is next with Kene Emagbodike.
We begin with tennis, where the organizers of Wimbledon Championships will receive a massive insurance payout of $141 million after the coronavirus pandemic forced the cancellation of this year's tournament for the first time since World War II. The All England club reportedly updated its Wimbledon insurance policy years ago to include the infectious disease clause following the worldwide SARS outbreak in 2002. The pandemic insurance package will allow Wimbledon to recoup at least some of the anticipated losses, although this year's tournament would have generated more than $300 million in revenue. In the meantime, the International Paralympic Committee, IPC, has a cash flow problem, but its president, Andrew Parsons, has ruled out going to the International Olympic Committee for help. Parsons says he is trying to cut 5% from the budget, which was listed at €24.1 million in the IPC's 2018 annual report. The cash shortfall stems from the postponement of Tokyo 2020 Olympic and Paralympic Games until 2021 because of the coronavirus pandemic. And in football, a former president of the Egyptian Football Federation